Hi, everyone. It's always a pleasure coming back to present here in our equity webinars. So following the equity webinar that Walter and I co-hosted last year, the next logical step was to understand how equity in health and healthcare is incorporated and routinized within real-life integrated care systems. Specifically, we reflected on the research question: what are international examples of governance and accountability for equity in integrated care? So this question was explored during an international case study that was presented in last month's webinar in collaboration with colleagues from the North American Observatory on Health Systems and Policies. And I would say overall, we found out that equity in health is often explicitly expressed as a policy priority in integrated care systems and models around the world. However, what this means in terms of providing services to disadvantaged groups, or the way the organizations distribute resources that meet the needs of the disadvantaged groups, really differs. So our international case study of England, the Netherlands, and Germany showed that there were great variability of equity promoting initiatives, both between the countries and even within the integrated care programs that's in the different countries. So in England, we noticed that various integrated care systems focused on different priority populations. So for instance, some of them actually focus on organizing and improving care for frail, socially isolated older adults. And these were mostly like in the rural and the remote areas. And while other integrated care systems, they focused on improving care for, racialized groups in the socially deprived urban areas. In the Netherlands, we found that there was heightened capacity for monitoring and planning at the local level. So this was a lever to advance their equity work. However, um, uh, models like the neighborhood care teams, they planned and rolled out different kinds of equity promoting interventions. For example, the neighborhood care teams in The Hague focus on investing in support for socially and materially deprived neighborhoods. Now, for multiple integrated care models in Germany also leverage monitoring and planning at the local level to advance their equity work. And one such example is the Hamburg Health Kiosk that carried out cultural adaptation of their healthcare workforce by investing in care providers that could easily communicate with their local population that face linguistic barriers to care. Learnings from this international case study. So the four main lessons that we could summarize was that successful equity promoting activities were most often related to local initiatives that decided to engage in actions to improve care for their local populations. This speaks to important elements of change, such as visionary and proactive leadership, as well as building capacities for equity work. So we also noticed that although these countries we studied had different priority target groups for equity work, a transversal pattern of three main groups emerged from our data. That is namely the socially and economically deprived individuals or neighborhoods, the old frail adults, mostly living in rural and remote areas. And also we noticed that Black indigenous populations of color, these communities, and recent immigrants were also target for most of the equity promoting activities. So access of data for evaluation and monitoring planning at the local level was critical to developing and implementing equity promoting initiatives. And finally, we did not find any system level examples where equity was incorporated within the governance and accountability frameworks. So although this system level governance can actually set priorities, which can lead to the reflections for equity and healthcare work. But at the operational levels, equity promoting initiatives still lack accountability, and this is an area for more research and how we can actually promote these practices. Thank you for that.